Hello, my name is Allison Warner. I'm the Chief Editor of Orthodontic Products. Thank you for joining us for today's episode of In the Sterilization Room with Jackie, where we talk to infection prevention expert Jackie Dorst about what you need to know to keep the orthodontic practices staff and patients safe during the COVID-19 pandemic and beyond. For over 20 years, Jackie has been a consultant specializing in instrument sterilization and infection control and prevention in the dental setting. She has degrees in microbiology and dental hygiene, and she has been a featured speaker at the American Dental Association and the American Association of Orthodontists. Hi, Jackie. It's good to see you again.
Hi, Allison. We've had another busy week during the pandemic here, and it's always good to be with you and all of the Orthodontic Products viewers.
Thank you. Yeah, it's great to be doing it. I enjoy doing this every week, and I think our viewers appreciate it. So this week we're actually going to tackle kind of some recent news. So news broke recently that Osha cited a Massachusetts dental office for a number of violations, including violating respiratory protection. But it went deeper than that and showed how they were failing at routine record keeping and training mandated by OSHA. So they were fined, as a result, they were fined $9,500, which, you know, given that things are tight right now, is kind of a big hit for a practice to take. So I wanted to talk to you about what orthodontic practices should know to make sure they're doing everything right to avoid getting in trouble. So this wasn't the first incident like this by any measure in terms of like where we are right now. So can you talk a little bit about that?
Well, what I've noticed that's happened both with clients calling me and reading on the OSHA website and talking with other infection control and OSHA consultants is that during the pandemic, because of apprehension about this new hazard for us of airborne infectious diseases, of the COVID-19 SARS or virus, that there's been so much concern about, are we adequately protecting ourselves when we reopen the offices, confusion about which type of mask to wear with which type of procedure that is going to allow us to safely reopen our practices and see patients, and all of the overlapping information that's come from CDC and the dental boards and OSHA. It's been a fire hose of information. And due to this uncertainty from dental orthodontic staff members, where they felt like maybe their concerns were not being taken seriously, there have been some situations where employees have actually called OSHA about what they felt were unsafe conditions, or going back to work too soon, or not having adequate PPE, or not properly scheduling patients, going back to a full patient schedule rather than allowing for that physical distancing and implementing the proper safety protocols. So as a result, there have been a lot of OSHA inspections in the last 6 months. And more so, and what happens when OSHA goes into an office, they receive a complaint from an employee, and so then they go to the office to verify what is the complaint, do there need to be made corrections. Then OSHA doesn't only look at, are they wearing N95 mask during aerosol generating procedures, and are they wearing them correctly, but they look at all safety protocols. And so they're looking at the bloodborne pathogens standard, which refers to infection prevention, to the hazard communication standard, which refers to chemical safety, to general safety, which looks at fire escape plans, emergency preparedness, and then finally the new respiratory protection standard or respiratory protection plan. And most offices, because previously we weren't dealing with the hazard of an aerosol transmitted disease, offices didn't have a respiratory protection plan. So this is new for orthodontic offices.
So what should a practice be doing for their respiratory protection plan? What does that involve at this point?
Well, as we reopened offices, OSHA actually published a booklet on what to do as you reopen your businesses, and it referred to a lot of businesses because OSHA is across the board. OSHA is under the U.S. Department of Labor, and its mission statement, its goal is to provide a safe and healthy workplace for all U.S. employees.
Mhm.
So in reopening your workplace during the pandemic with this airborne hazard, if you will, they listed the risk for different type of employment situations. Someone would be at low risk that works in an office all by themselves and never has contact with the public or anyone else.
Yeah.
So they're at the bottom of the pyramid. In the middle of the pyramid might be an employee who has minimal, brief contact with other people and is wearing a mask, say the UPS delivery guy, or maybe the cashier at the grocery store, and they're behind a shield now. That was one of the recommendations from OSHA. At the very high risk was like orthodontics. And then at the very highest risk were dentists and dental hygienists because of the aerosol procedures that they create with an air turbine handpiece, with an ultrasonic scaler, with prophy jets. Of course, that creates all of those aerosols. The patient is not wearing a mask during care, and it's unknown at this time. Science takes time to collect data and do the research to determine how long do these virus particles stay suspended in the air, and even if they are suspended for 2 hours, are they still infectious? And does that N95 provide us with adequate protection? And even after we've been open for 2 or 3 months, CDC and OSHA included in their PPE recommended for the oral health profession, for dentists, for orthodontists, to wear goggles or eye protection. Because it's believed that the virus is capable of being transmitted through the soft tissue, the mucous membranes around the eyes. So some changes, and there's been constantly ongoing changes as both OSHA and CDC and the state dental boards learn more information about this emerging virus with it.
So in terms of that respiratory protection plan, then what, it's about using the respiratory protection, but is there some other aspect that practices have to have on hand to show that they have a respiratory protection plan?
They actually have to have a written respiratory protection plan. And the basic elements, just like having a written bloodborne pathogen standard, that refers to how you do everything in infection control. I'm going to refer to my notes because there's some specific things in that respiratory protection plan. First of all, it must be written. Next, there must be a respiratory protection coordinator. That's usually going to be the OSHA coordinator, obviously, because they're familiar with record keeping and what forms are needed and how to provide training with it. Next is to assess the hazard. Well, a hazard is for airborne diseases, and it's not just SARS-CoV-2, the virus that causes the COVID-19 infection. Measles is also an airborne disease, highly infectious. And it is documented with research that measles virus can stay suspended up in the air for 2 hours after patients say was it just in the reception room with it. Tuberculosis, the rhinovirus that causes cold, or influenza. Those are all airborne, potentially viruses that can cause disease. So what's the proper protection that we need to take with this hazard? So we assess the hazard, and where's our greatest risk with aerosol generating procedures. So in the orthodontic office, it would be during bonding, debond procedures, changing an arch wire or delivering an aligner. That would be a lower hazard and might not require that higher PPE level of protection that they would need with aerosol generating procedures. So you identify the hazard. Now you're going to select what's the proper protection. And with aerosol generating procedures, that would be an N95 respirator mask along with eye protection, and then using any other aerosol mitigation that you could. Well, once we change in the orthodontic office from wearing what is referred to as a procedure mask or a surgical mask that you just put it over your ears and crimp it over your nose and you're good to go. A respirator requires a fit test. To reassure that you get a complete seal, because the difference between that N95 respirator and a procedure mask is that it does fit closely around the nose, does not allow any air to escape, both from the wearer or air to come in around the edges from the aerosols that we're creating. So that N95 respirator must be of the correct size. Some people have wider faces. Some people have more petite faces and might need a small size respirator.
Right.
The employee needs training on how to put it on, how to do a seal test where you actually seal it around your face, and then you blow out to see if air is escaping around the edge, and then inhale to see if it compresses a little bit. So you do a seal test every time you put it on.
Right.
And even in training on how to properly remove that. Now, prior to wearing that N95 respirator, OSHA has stated that all employees should have a medical evaluation. Will their respiratory system tolerate the difficulty that it might be breathing through that greater filtration device? Can they tolerate the maybe extra heat even that is created with it? Maybe people who have COPD or even asthma might not be able to wear an N95 respirator for a length of time. So the medical evaluation, once that's cleared, and OSHA even has a specific medical evaluation form that all of the orthodontic offices can download from the OSHA website. So I think you can show that to our viewers now. Then you would do the fit test. And the fit test has the employee don their N95 respirator, seal it around their face, and then a hood is actually placed over their head. And then there's a chemical, either a sweet or a bitter chemical, that's injected inside that hood. And if the employee can taste or smell that sweet or bitter chemical, then they don't have a correct fit. Their respirator is not sealing and fitting around their face. So the recommendation is to reseal and then reapply the fit test hood and try again. And you have the employee move around and do some exercises to see does it get dislodged during normal use. And if it does seal then you're good to go. You sign off and you've done your initial fit test with it. If the office changes brands of N95 respirators that they're using, then they have to do another fit test all over again. Because you can see how each N95 respirator brand might fit differently, have a different configuration with it. So that documentation, both for the medical evaluation and the fit test, must be on record for all employees who are going to be doing aerosol generating procedures identified as a hazard that requires an N95 respirator. So that's another part, how you're going to do the fit testing, who provides the training on how to do the seal test and the fit testing. And then you've got to evaluate that everybody's doing that correctly. We don't get in a hurry and just put it on and, we didn't do the seal test or something. There has to be some ongoing evaluation to make certain that you're doing that correctly. Now, remember at the very beginning of reopening, after we closed all of our orthodontic office, there was a severe shortage of PPE.
Right, yes.
N95 respirators were not available. FDA gave an emergency use authorization, an EUA, for using foreign N95s that are normally not KN95s. And there was even a shortage of those. And then FDA notified the profession of fake N95 respirators. So we went through this, what was called a crisis PPE shortage, and under that emergency use authorization, what would normally be a single-use mask was allowed to be reused or used for extended period. And even there was a lot of investigation about how can you decontaminate these masks to extend, the use and preserve PPE as it went on. The mask manufacturers are now catching up. The supply chain is refilling, and it's even estimated that by the end of 2020, we will have a readily available supply. So that emergency use authorization will go away. Part of that emergency use was that OSHA said that it was not necessary to do the annual fit test for employees wearing N95 respirators. But that they didn't dismiss the initial fit test. So that initial fit test and that medical evaluation is still required. And then as the supply chain refills, OSHA will re-implement that annual fit test training, just as we do an annual bloodborne pathogens training for infection control, that we are checking everything we do and that we're up to the standard of care for
Right.
safety on it. Yeah, so we've gone through all of the elements that need to be included in that respiratory protection plan. So not real complicated,
Mhm.
but you do have to hit all of the pickets in the picket
Right.
fence
Yeah.
to have that written respiratory protection plan.
Right. And we should point out one of the things that dental practice was dinged on was related to N95 mask fittings. So
Yeah,
that's why, we wanted to talk about this, because that is something that orthodontic practices are also dealing with and need to make sure that they're doing the right thing and have their ducks in a row, basically. So,
exactly. Yeah.
okay. Well, so the dental practice we're talking about in Massachusetts was also cited for a number of other violations that get down to basic OSHA safety standards. So this gets into the fact what you were saying earlier about, when a complaint is filed, which may be related to how a practice is handling COVID right now, OSHA is going to come in and actually look at everything. And so this
Everything.
practice was dinged on basic OSHA safety standards that the practice should have been and should be adhering to even before the pandemic. So beyond the respiratory issue, one of the things they were cited for was failure to have written programs for a number of safety issues. Can you explain, you talked a little bit about the written program for respiratory, but can you talk about the written programs that a practice should have on hand and to make sure they have in hand at this point?
Yeah. The written program for the bloodborne pathogen standard has to review the 7 components of standard precautions.
Okay.
Hand hygiene, general PPE for splatters and splashes of bloodborne pathogens, HIV, hepatitis B, hepatitis C, and how you sterilize instruments, using a proper disinfectant for those. So all those components of standard precautions need to be reviewed, as well as your dental unit water lines. Have you disinfected those, and are they under that 500 CFU? The next one is going to be on chemical safety, and that means do you have a list of the chemicals that you use in your office? Have you provided safety training, say, on the cold sterilization solution, if you still use that? Do you have the safety data sheets on that? And has the office put in the new globally harmonized labeling system that replaced the NFPA labeling system? And then getting into general safety. Have you checked your fire extinguishers? Do they still have adequate pressure and chemical? Does everyone know the fire escape plan? Do you have an emergency preparedness plan that if you had to exit the office? Or what would you do if you had that crazy person show up at the front desk that thinks they're either going to get money or drugs from the ortho office? How do you manage that emergency? What does the team know exactly what to do? So having all 4 components, having the bloodborne pathogen infection control plan, the chemical safety plan, general safety plan, and now the respiratory plan completes the OSHA safety program. And OSHA still requires that annual training on all 4 elements of that every year for employees. Initial training for new employees, and then an annual training. And then all employees should know where the OSHA manual is located. It can be digital or it can be a printed version, but everyone should be able, if the OSHA inspector came in and was doing a review of the office and said, who would you report an accident to, or who would you report unsafe measures to? Then the employee should know who's the OSHA coordinator, and then be able to tell the inspector where the OSHA manual is. When those safety programs are not complete, then there's a risk of getting a fine or citation. The OSHA inspector will always go to record keeping. They can't always document that everybody washes their hands every time they remove their gloves, because obviously if the inspector's there watching you, you're going to do everything with a lot of attention to detail. But they can look at the printed records. So they're going to want to see the documentation of the last safety training. And I noticed even in this OSHA inspection that one of the items that they listed on there was an inadequate eye wash station. And it may be that eye wash station, which is for chemical safety with it, was not installed properly on the sink. Maybe there was still hot water going to it. Maybe the employees didn't know how to use it, or maybe it just didn't work. So all of these elements of safety we need to pay attention to them. They don't have to be time consuming, and you do have to have training for it on that annual basis. Yeah.
So where should an orthodontic practice turn if they need help putting together their their OSHA standards, or just, creating that written documentation?
Well, one of the good places to start is the AAO. The AAO on their staff club learning program every year provides an updated OSHA webinar that's available on demand for
Okay.
all of the team members. I give it every year. I've been privileged to do that for over 12 years. And it goes through all of the components, and then you can print out your CE certificates afterwards, and that can be documentation of the employees training with it. It's also a great guide for an OSHA coordinator, someone who's new to the office and wants to be certain that they're covering everything. They can view that webinar. The one from November of 2019 is available, and the next one will be December the 1st. So it will be a comprehensive, including the respiratory protection plan. On October the 8th, I will do a webinar for the AAO on just the respiratory protection plan, how to write it, and what are the elements that need to be included in it. Now, for the OSHA manual, many offices may have an old one. I frequently get calls from the offices, and they go, Jackie, we have 3 OSHA manuals in the office. One is from 1998. The other one is to 2005, and I don't know about this other one. They're a little overwhelmed and confused.
Yeah.
And I have a single checklist that I said, let me send you the checklist. And you could look on that checklist and see if you have all those elements in your OSHA manual. And if not, you may need to get an updated one. Now, resources vary. The American Dental Association has a generic one for the dental profession. Some states, the California Dental Association provides to all of their members a Cal OSHA manual free that can be downloaded and is digital. And then I created, as many other consultants have, an orthodontic OSHA manual. So there are multiple resources, and an office with all of the resources available from OSHA, they can actually create their own OSHA manual. It's much better for them to do that than to order one from a resource that comes wrapped in the nice plastic wrapper. And when they receive it, they put it up on the bookshelf. And should the OSHA inspector come in and they say, oh, yes, we have our OSHA manual, and they take it down and it's still in the plastic wrapper, that's not a customized OSHA plan. It should be opened up and customized again for the office. So that's really what OSHA wants to see, is a functioning, doesn't have to be pretty, but a functioning OSHA manual.
Okay. So so I guess the point we should be made is it should be customized to your practice and your state. So, okay. Well, Jackie, thank you so much. I think that's great information for our viewers. We will be back soon for our next episode of In the Sterilization Room with Jackie. In the meantime, to catch up with past episodes or to check out the latest orthodontic industry news, please visit our website, orthodonticproductsonline.com. Until next time, take care and stay safe.
Thank you, Allison. Think positive and stay negative.
Excellent. Take care. Okay.